Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I get to today's COVID-19 update, I want to talk about the important role that texting plays in the contact tracing process and how Albertans can help make it even more effective. To help reach confirmed cases and their contacts quickly, AHS's contact tracing teams are often using text messages. When a case is confirmed, AHS will text that person first with a general message asking them to accept an important notification from AHS. If the person accepts via return text, they receive their result. There has been a strong uptake of these texts, likely because these individuals are expecting AHS to be in touch with them. However, we've been receiving less responses from close contacts who are also being alerted by text message. This could be because people aren't sure if these are legitimate messages and may worry that this is a scam. If you receive a text message asking if you consent to receiving an important message from AHS, please accept it. You will then receive another message with information specific to you, exposures you have had, and instructions you need to protect those around you. If you receive this message, it is not a scam. It is a legitimate communication and will allow our hard-working contact tracers to move on to notifying the next person in line in the most efficient way possible. When people do not respond to the text, they will still be notified that they are a contact, but our contact tracers then need to make individual phone calls, which take longer. With cases rising, we can all help make our contact tracing system as effective as possible by enabling this efficient means of communication. Turning to today's update. Over the last 24 hours, we have identified 1,857 new cases of COVID-19 and completed about 17,500 tests. Our positivity rate currently stands at 10.7%. These are concerning numbers that underline the fact that we have work to do together. We have identified 1,326 additional cases of variants of concern in the last 24 hours. Variants currently represent about 60% of our active cases. I also must report that we have now confirmed the first case in Alberta of the B.1.617 variant, first identified in Denmark. It's also been found in California and is a key driver in the rise of rapidly spreading cases that we are seeing in India. This variant was in a returning interprovincial traveler to Alberta, and no additional cases of this variant have been detected to date. As with all new variants, research is underway to understand what may be different about the B.1.617 variant, how it spreads, and if it creates more severe illness. So far, we are calling this a variant of interest as we work with colleagues across the country to monitor the latest findings on this variant as evidence emerges from around the world. There are now active alerts or outbreaks in 612 schools, which represents 25% of the schools across the province. A total of 3,502 cases have been linked to these schools since January 11th. Today, Edmonton Public and Catholic school boards moved grades 7 to 12 online for 2 weeks. Consistent in the approach in both Calgary and Fort McMurray, when they shifted these students to online learning, all extracurricular, youth sport, recreational, and performance activities for these ages are now required to either take place outdoors or be paused in Edmonton. This requirement will stay in place for the same 2-week period to assist in slowing down transmission in this population. There are now 518 people in hospital being treated for COVID-19, including 116 in the ICU. It's important to remember that hospitalizations are a lagging indicator, and these individuals in hospital were likely first infected around 2 to 3 weeks ago. Given how high our leading indicators, growth rate, new cases, and positivity rate have been, we can expect to see this number grow in the coming days. We must bend this curve down to prevent these severe outcomes and the subsequent impact on our healthcare system. Sadly, I must announce that 6 new deaths were reported to Alberta Health in the last 24 hours. We must always remember that all of these numbers represent people. Every death involved someone who was loved and loved many. My thoughts are with everyone who is mourning a loss, whether from COVID or any other cause. In the last 24 hours, more than 42,300 doses of COVID-19 vaccine were administered in Alberta. As you know, in order to make these doses count as much as possible in combating the spread of COVID-19, our second dose interval aligns with national recommendations to extend up to 4 months. Having said that, we have continuously been reviewing emerging research, and today we are making a slight change in how we approach second doses for select populations who may not respond effectively to their first dose. Effective tomorrow, those in Alberta who are undergoing specific kinds of cancer treatments or who are on other medication that results in a level of profound immune compromise will be able to book a second dose 21 to 28 days after their first. This aligns with Ontario's approach and is specifically limited to Albertans who have received solid organ or stem cell transplants or who are currently undergoing specific immune compromising treatments such as chemotherapy. This will also apply to individuals being treated with an anti-CD20 monoclonal antibody such as rituximab. To be clear, this timeline applies to these individuals only due to their extremely weakened immune system. Also aligning with Ontario, anyone receiving solely hormonal therapy, radiation therapy, or surgical intervention for cancer, or other therapies that are not as profoundly immune compromising, will continue to receive their second dose at an extended interval no later than 4 months after the first. This is because we know that people who have compromised immune systems are also protected by protecting those around them. And offering a first dose to as many people as possible, as quickly as possible, benefits everyone. Individuals who meet the profound immune compromised criteria I outlined earlier can book their second doses starting tomorrow by calling 811 to receive their second dose 3 to 4 weeks after the first. Second dose appointments for these individuals cannot be booked through pharmacies or the online booking tool. Calling 811 is required. All other Albertans will continue to be eligible no later than 4 months after their first dose. Evidence indicates that the first dose of all currently approved vaccines appear to be at least 80% effective in protecting against severe outcomes after this first dose. Bookings for second doses for all others will begin when supply allows, after all Albertans 16 and older have been offered a first dose, likely to happen later in June. When more doses arrive this summer, we will look to start shortening this interval if possible based on available supply. As cases continue to climb in the province, it's critical that anyone who is eligible gets vaccinated as soon as possible. This protects the individuals who are vaccinated and those around them. It also helps limit community transmission of COVID-19, which will relieve the building pressure on our healthcare system. I urge anyone who is eligible who hasn't yet booked their first dose of COVID-19 vaccine to book their appointment today. This can be done through AHS's online booking tool by calling 811 or through one of many participating pharmacies province-wide. A number of pharmacies and AHS clinics are also accepting walk-ins for the AstraZeneca vaccine for those 40 years of age and older. For clarity, anyone included in Phase 1, 2A, 2B, or the first part of 2C is eligible to get their vaccine now and will continue to be eligible throughout the vaccination program. After a year of being asked to physically distance, stay home when sick, wash our hands and wear a mask to help fight this virus and get us through this pandemic, we finally have another tool at our disposal to help us, this vaccine. However, its effectiveness relies on how many of us choose to use it. please make the wise choice to get your shot as soon as you're able to do so. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through our first caller, please?
First is Jeff Slack with 660 News. Go ahead, Jeff.
Hi there. Thanks for taking my question. With Alberta reporting the new B.1.617 variant case, are you worried about seeing an explosion of this variant, given the B.1.1.7 variant didn't take long to become the dominant strain in Alberta?
What we don't know yet about the B.1.617 variant is whether or not it is indeed truly more infectious than these other variants of concern that we currently have in the province. And what's important as we hear about new variants of interest or new variants of concern is that the precautions that we have been working towards, building habits towards for more than a year now, if we do those things consistently every single day, we can create that wall of protection that protects our families, ourselves, and our communities. So whether it's B.1.617, B.1.1.7, P1, any of the other alphabet soup variants of interest, the really important thing is consistent approaches to public health measures. We will continue to monitor all of these variants of concern, but what's critical, again, is that consistent approach to preventing transmission every day in all of our actions.
Jeff, is there a follow-up question?
Yes, just on a sort of different topic. We're starting to see numbers that we haven't seen since the peak of the second wave of the pandemic. I'm wondering how are we going to see restrictions come in either this week or next week, because we are continuing to see this exponential growth?
The decision-making around restrictions is complex and involves multiple factors, and so final decisions have not been made about whether or not restrictions will be coming in.
Operator, could you put through the next caller, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. Rural pharmacies say that they have had to cancel hundreds of appointments because of a lack of promised vaccine. Are you concerned that Albertans who live in rural settings won't be able to get a shot if they can't drive to a major city?
Unfortunately, pharmacies who have Moderna supply are affected by the fact that our Moderna supply was unfortunately cut by more than half and delayed. And so this is a function, again, unfortunately, of the fact that our vaccine supply is part of a global system. There's demand around the world for these vaccines, and manufacturers are working hard to keep up with that demand, but there are unforeseen circumstances. Knowing that, we are working with our pharmacy partners, we are working with Alberta Health Services, and trying to adjust our supply and allocation as best as possible to make sure that Albertans in every part of the province have access to the vaccine. But it is, of course, a challenge when our shipments that are planned for unfortunately change, and then we need to do some of that reallocation planning. So again, I would ask that participating pharmacies, Albertans, I know it's challenging sometimes, but I would ask that we continue to urge patience, and we are working as quickly as we can within our existing supply and those constraints to make this available to all Albertans in every part of the province.
Kevin, is there a follow-up question?
Yeah, Dr. Hinshaw, I'm wondering if you can explain the rationale of not just opening the Pfizer and Moderna shots to everyone who wants one right away. There seems to be some supply being held back, so why not just open it up?
So I'm not sure how that information about supply being held back. The work that we're doing with our partners and with our planning is to use up all of the supply that comes in as quickly as possible. Sometimes it's challenging to know as we open to particular groups what the uptake will be like in that particular group. So sometimes we do need to shift if we have been planning for a particular group and moving to make that group eligible. And if we do see lower uptake, then we may not see the same rapid use of that vaccine. But we do not, unfortunately, have enough supply for all Albertans who want it at this point. I wish that we did. But again, what we're doing is working to make sure that we get vaccine to those who are at the highest risk of severe outcomes, to those who care for those who are at the high risk of severe outcomes, as well as those who are in settings where we have seen very large outbreaks spread very quickly from one to many. And that's the process that we're using to try to make that vaccine as quickly available as possible to as many people as possible by working through that sequencing list.
Kevin, we're happy to get you additional data offline. Operator, could you put through the next caller, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. Other provinces have targeted their vaccine programs not just to broad categories of ages or professions, but narrowing in on COVID hotspots with pop-up clinics in certain neighborhoods. Why is Alberta not doing something similar when we do have our own sort of hotspots in the province that are exceptionally higher than other places in terms of infections?
What's interesting, if you look at Alberta and you compare to other provinces, there is a national data tool available online that splits out the rates by health regions. And when you look at that, it's interesting because you see that Alberta has the broadest dispersion of very high rates of all the provinces, where we do see very high rates across the board. And what we're doing right now, as I mentioned, is focusing on those at high risk of severe outcomes and mitigating opportunities where the virus could sometimes spread very quickly from one to many. If we were to divert vaccine only to particular geographic areas, given our very significant risk that exists across the entire province, the challenge again would be that we would be taking vaccine away from some who are at high risk of severe outcomes in order to focus on a spot that, while it may have slightly higher rates than the other spot, we have no areas in this province that are at low risk. So we are continuing to focus again on a provincial approach that does make sure that everyone who is at individual high risk of severe outcomes, as well as all those locations at high risk of explosive outbreaks, have access to vaccine as soon as possible to mitigate the impacts of the current surge that we're seeing.
James, is there a follow-up question?
Totally, yeah. So, I mean, the differences aren't necessarily slight. I mean, you look at Calgary, Upper Northeast, for example. I think their new infection rate is almost twice the provincial average. So I just wonder, how do we justify giving, someone who lives in downtown Calgary, healthy 40-year-old with, working from home, giving them a vaccine before someone younger in Upper Northeast, where 1 in 10 people have had COVID at some point during the pandemic?
Sure. So again, with AstraZeneca, we know that there are issues with respect to, while very rare, the association of AstraZeneca with the vaccine-induced thrombosis or blood clots that's been seen. And so, I think that there have been challenges if we felt that we were not offering choice to all those across the province. So we have chosen to make that available province-wide, which includes those areas in Northeast Calgary as well as downtown Calgary. We are making sure that where there are very specific high rate areas, that there are AstraZeneca clinics available in those areas to provide access with as low a barrier as possible. However, again, knowing that the rates are high across the province, we want to make sure that we are providing that opportunity to as many people as possible. And specifically with the AstraZeneca vaccine, we do believe it's important to offer choice on that particular vaccine, which is why it's been offered in the way that it has been.
Operator, could you put through the next caller, please?
The next caller is Julia Wong with the Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. You announced earlier changes for certain groups to have a shorter dosing interval when it comes to their vaccines. There's research showing that those elderly could also benefit from an earlier second dose, but I don't believe they're included in the groups you announced. So what about changes to second dose timing for the elderly? Do they qualify for a shortened dosing interval?
The benefit of the evidence we currently have available for seniors is that while there are some similarities in terms of the antibody level research, we actually have real-world effectiveness data of vaccines, which unfortunately we don't have for those groups that I mentioned earlier. And what the real-world effectiveness data tell us from BC, from Quebec, and from the UK is that even in those over the age of 70, there is a very good response to the first dose of vaccine that protects against severe outcomes. So even though the antibody levels are lower than someone who's younger after that first dose, the real-world effectiveness show that age differential doesn't make a difference in terms of the protection level that first dose offers. Again, because we don't have that same data for those with these specific medical conditions, we're erring on the side of caution and offering the second dose at that compressed interval. But we do have that data for those who are elderly, and again, we know, therefore, that first dose will provide a high level of protection against severe outcomes, and that, again, all those who, whatever situation they may be in, are benefited not only by their own dose, but by the doses that others around them get to protect them indirectly as well as directly. So that's why we are only shortening the interval for those very specific groups that I mentioned earlier.
Julia, is there a follow-up question?
Yes, thank you. I know we're still learning about this new variant of B.1.617, but at this point, do the approved vaccines protect against this?
It's too soon to say with certainty. The place that has reported most of this particular kind of variant is in India, and so we don't yet have that information, which is why, again, this is deemed a variant of interest. At this point in time, while we're looking very closely at the evidence, there hasn't yet been an assessment that from the Canadian perspective, when we look at the evidence, that this particular variant is shown to have a decreased response by the vaccine. We continue to, again, monitor the evidence, and I want to reiterate that whatever the type of COVID-19 virus that shows up in this province, that we have the collective ability to prevent its transmission through the actions that we're all familiar with, that are those basics of making sure that we're staying distanced from others outside our household, wearing masks when we're indoors with others outside our household, staying home if we're sick. And so whatever the type of variant, we do have the tools to be able to prevent its spread.
Operator, could you put through the next caller, please?
Next is Jason Herring with the Calgary Herald. Go ahead, Jason.
Hi, Dr. Hinshaw. Just wanted to kind of go off of the question Jeff asked at the beginning of the session. It's been 14 days now, more than 14 days now since we moved back to step one, meaning we would expect to see the impacts of that decision in our case rates by now. But we got our highest case count in the third wave today, and we're nearing our highest point ever for daily cases. I mean, I know you said this is a complex decision, but I'm wondering, why not put in more restrictions now, or take a serious look at this right now?
As I mentioned, those decisions have multiple factors, and those decisions are made by elected officials who are appropriately the ones to make those decisions. And conversations are ongoing, looking at all those factors that need to be weighed. And again, these levels are concerning. We certainly need to be responding as we are with as fast a vaccine rollout as we can have, with the measures that we are putting in place, again, those that are province-wide that were put in place 2 weeks ago, as you say, as well as targeted measures, ensuring that where we are seeing spread in school-aged children that is disrupting the operations of schools, that we're making sure that the measures put in place to limit transmission within those age groups, that we are adding to that by restricting the interactions of individuals in those particular age groups indoors for the length of time that school in person is paused. And the need for any additional measures, again, is being discussed, looking at the data and multiple factors that weigh into that decision.
Jason, is there a follow-up question?
Yep, slightly different topic. There seems to be a significant backlog in booking tests right now. Bus in Calgary are only available 3 or 4 days in the future to get a swab. Wondering what the province is doing to address this demand for testing amid the surge in cases, and whether the backlog is impacting the speed at which lab results are returned as well.
The lab is keeping up, so as soon as swabs are sent in, the lab is able to turn those around very quickly. The time interval between when someone is seeking a test and when a test is available, certainly that's something that we're aware of, that as the demand for testing has increased, there's been a need to add additional time slots, to add additional capacity to those swabbing clinics. And what I would say is that if someone is looking for an available test, a swab, that they either are close contact or they have symptoms, If the site that is closest to them doesn't have an opportunity or an appointment available within the next few days, I would encourage them to look in a broader radius, because we know that again, Alberta Health Services has added additional appointment times and is working hard to make sure that within a city or a local area that there are a range of appointments and that people can get a swab within 24 to 48 hours. But unfortunately, that may mean that they need to travel a bit further. But AHS is working hard to rectify the situation and make sure people have that timely opportunity to get a swab.
All right, we've got time for 2 more callers. Operator, could you put through the next one, please?
Next is Lauren Boothby with the Edmonton Journal. Go ahead, Lauren.
Hi, Dr. Hinshaw. The Premier said in a Facebook Live video last night that we are at the highest point of COVID cases Alberta's ever seen, that about 5% of active cases typically end up in hospital 2 weeks later, and so we could have 1,000 people in hospital in 2 weeks. And if that doubles, we could have 2,000 people soon in hospital. So our hospitals and ICUs could be overwhelmed really soon. I know that AHS has a draft triage protocol for how to prioritize who gets into the ICU and on a respirator. Can you please tell us what that protocol is? Essentially, how will doctors decide who lives and who dies if our ICU beds are at capacity?
We never want to end up in that situation. And so, again, if cases continue to rise in an accelerated way, obviously that would be that worst case scenario, that we would end up in a situation where that kind of triage needs to happen, but that is not a scenario that we want to happen. The specifics about that triage protocol, I don't have at hand. Again, that's something that was developed within Alberta Health Services, so we can follow up offline and get you information on that. But my understanding is that that protocol was developed with careful consideration of many different factors, including ethical consults and weighing out, again, if we were ever to be in that very challenging situation, that there were those kinds of details available to clinicians. And again, our wish is that we would never end up in that situation.
Lauren, is there a follow-up?
Yes, it would be great if you followed up offline, because I've already asked for that information and haven't got it. But so will you release that triage protocol to the public and also tell the public when it's been activated so that they know if they end up in hospital, they might be triaged in that way?
Again, that protocol is not mine, so I can't speak for Alberta Health Services, but we can certainly follow up with respect to the questions that you've asked.
Operator, could you put through our final caller, please?
Final question is from Vincent McDermott with Fort Mac today. Go ahead, Vincent.
Good afternoon, Dr. Hinshaw. I know both yourself and the government has said in the past that Alberta's healthcare system is prepared to expand current bed capacity now, especially as these variants spread. But a bed is more than just that when you also include staffing, medications, equipment, ventilators, and other resources. So what is Alberta's staffing ratio like for this expanded capacity, especially when you consider that not everyone is interchangeable and certain physicians that have no experience in the ICU could need weeks or months to be brought up to speed? Where is this extra staff going to come from as cases are going to continue rising?
The operational details of exactly how AHS would accommodate that, again, I don't have. We can follow up. But what I can say is that in order to expand capacity to treat patients with COVID-19 in acute care, both hospital and ICU, the way to expand capacity is to, unfortunately, stop or delay treatment for other types of health conditions. So I want to reiterate that as cases expand, the impact on hospital means not just that there's more people who require that COVID-19 treatment, but also that there's less access to other kinds of treatment, because it's only by delaying those kinds of other treatments that there are those available staff and other capacity resources to be able to redeploy if there is a surge of COVID-19 patients. So all of these are the reasons why it's critical that every one of us, every day, follow the public health measures to limit the spread of COVID-19 and make sure that we are part of bringing down our numbers and protecting our healthcare system.
Vince, is there a follow-up question?
Yeah, sure. When I filter out the conspiracy theorists, the top question I seem to get from the public is, hey, look at all these oil sands outbreaks. How many workers at these sites are sick? So I'm wondering, how come this information is not included in online updates, and is this ability going to be introduced in the future?
So I'll have to take that away with our data team. I know that we do produce reports of all workplace outbreaks where there are 10 or more cases associated with a particular location. As you can imagine, our numbers change on a regular basis, not just with outbreaks, but of course, all of our numbers across the province. And so to keep a regular update of the exact number of cases in each specific outbreak would be something, again, that our EPI team, because it is constantly changing, it's extremely difficult to keep updated in a regular way. However, I understand that the public is interested in the information, not just whether or not an outbreak has 10 or more cases, but how many cases. And we have always done our best to be as transparent as possible. So that is a question I can take back to see if there's anything that can be done.
Thank you all for joining us. Dr. Hinshaw will provide another live update early next week. Have a safe evening.